Yeah, I think, I mean, asking about their education is probably something wise to do. Along with asking, say, whoever's making the phone call has shoulder pain. If you can ask on the telephone, I have shoulder impingement, the doctor diagnosed me with this. What kind of stuff would you guys be doing? What would my first session look like? And then pretty much go from there. And if you like their answers, go with it. If you don't, you could read, I mean, there's reviews all over the place with all those websites they have now. I don't know how honest those are, but a good physical therapist doesn't even worry about that stuff because we don't have to. A trainer, first there's an educational difference, but for the most part, if you find a good enough trainer, they could be pretty similar, but we do a lot more hands-on work, so we can mobilize joints, we can diagnose things. I can diagnose an ACL tear, whereas the trainer, I don't know how comfortable they would be doing that. They're not really taught that ever. So I can diagnose, I can treat people with an injury, whereas trainers mainly focus on exercises and mobility, and there's a bunch of other aspects of exercise, but that's primarily their focus. Whereas us, honestly, I could get someone in here with diabetes and know exactly what to do with them. If they have numbness in their foot or sciatica or neck pain, shoulder pain, and then how to rehabilitate them back to anything high-level activities, even professional athletes. The educational difference, I think for a personal trainer, it varies. You can get a CSCS, which I think takes 2 years, and then you can get a weekend course and get a certificate in practice as a personal trainer. For a physical therapist, back in the day, you just needed a bachelor's degree. However, now the profession itself is moving towards a doctorate degree. By 2020, I think they're trying to get every physical therapist to have a doctorate. And I went to USC, which actually was the first school that created the doctorate program. So very quickly moved from bachelor to master's, now to doctorate. So it's coming up quickly, and I like where the profession's headed because it gives us a little more stability. Yes, because honestly, there's a lot of physical therapists out there that I wouldn't want to go to. I wouldn't send my parents there or my children there. So us uplifting the whole career itself honestly helps every physical therapist because everyone realizes now what we do and how beneficial we can be. Toughest part about my profession from a business standpoint has to be the medical billing. It's all messed up. Yeah, if they could fix that, we could do a lot more with patients because we have to spend a lot of time trying to figure that stuff out as the owner, especially me. Most of my staff don't worry about it unless they're part of the billing aspect of it, but for the most part, billing's hard. And then in terms of me and a physical therapist, I think the most important thing we have to get through is we need to find what someone's passionate about so that we could help them get to that goal, because then we could connect and they know we're pretty much trying to help them reach their goals.
Thank you for watching A Wise Way. Subscribe to stay updated, share to pass the knowledge, or view our other videos on the left.